Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Hi, everyone. This is Dr. Keith. I'm back on at it today. Um, I guess I'm still must be doing okay. They haven't locked the doors yet and tossed away the key. That key still works, so they let me in to do this podcast. So like I said, as long as they keep letting me open the door and go in, I guess I'm doing okay. So I'm glad that appreciate all the support that we get, all the emails that we get, and appreciate all of them. I look at every single one of them and respond to. So if you have any questions or anything about anything that we cover today's podcast or any podcast in the past, feel free to just send me an email. The email's in the show notes. And like I said, I respond to all the email requests. I don't have a staff to respond to it. So it's actually me. So if you want to send it to me, have a question that might come up that you heard something on the podcast, maybe needs clarifying, or something like you want to get more information on that you heard on the podcast, really appreciate it. So we really appreciate all of the people that support our podcast. Like I said, just continue to support us, continue to subscribe to us. If you have a really good episode, you can pass it along to a family or friend. Like I said, anywhere that anybody has internet, they can listen to the podcast. So you're not limited by geography, anybody in the world. As long as you have an internet connection, you can listen to this podcast. So we really appreciate the people that help spread the word about this podcast, because what we want to do is provide information. Information a lot of times we don't necessarily get, or you may questions that you may want answered that you may not thought of. Maybe you didn't think of it at the time at the doctor's office, or maybe you were intimidated at the doctor's office and felt too scared to ask a question. But that's what we're here for. Provide information directly to you. And like I said, you can always respond to us if you have any questions. If something that you want us to cover, we'll be glad to cover that. Or did you know someone that's will be an interesting guest or you want to hear from? Just send us their information or the person's name. We'll reach out to them and see if they want to come on the podcast. I'm so glad that I have the guest that we have on today. Like I said, I think every episode is important, but I think this one is important. So make sure after you listen to this podcast, if you have a friend or family member that may benefit from it, just send them. You can forward this podcast to them, or you can have them listen and say, "Hey, listen to my Dr. Hersey in the Destroying Diabetes podcast. You need to listen to this because this episode is really good." Um, this episode, I want to point it to the men in our audience. Know that we have a lot of men that listen, or their wives listen to the podcast and have them listen to it and stuff. So I want to take the time out on this particular podcast to focus on the relationship of men's health, especially like urinary health, and the relation with type 2 diabetes. A lot of times that's something that's not talked about as much as some of the other issues with type 2 diabetes. I mean, people are aware of the effect on eye health and blindness, and the effect on amputations, losing limbs, especially like feet, problem with feet and stuff like that. And then some people realize the things about stroke and brain health, which we talked about in the previous episode. I am so glad to have Dr. Aaron Lentz on here today. He is a professor at Duke University. He's also a urologist at Duke University. He is an outstanding expert. I was so lucky to have him work with him this summer. We worked on a program at White Rock Baptist Church in Durham, here in Durham, North Carolina. It was so informative. We had people coming up to us even today, saying how great that program was and wish we could do it again. And I hope that we can do something like that again in the near future, because just the positive feedback that we got with that. And what we were working with was the issues of men's health and just dealing with that and topics that, and it was great. It was like like basically a men's only room where men could feel free to ask questions without any kind of shame or embarrassment or judgment. And I think we got a lot accomplished in that program, just having that type of environment. So what I wanted to do is just have Dr. Lentz on here and talk a few minutes about the relationship between type 2 diabetes and men's health, and especially urinary health. That's that we don't talk about a lot, but there's a big correlation there. One of the reasons why you need to have your type 2 diabetes under control, because they can affect your urinary health. And again, I just like to just thank Dr. Lentz for taking a few minutes. I know he's extremely busy, and I'm just really thankful for him to take a few minutes to join us on the podcast today. So, how are you doing, Dr. Lentz? Is there anything you want to say as an opening statement?
Yeah, well, first of all, I just want to say thank you. I want to say thank you, Dr. Hersey, for inviting me. Yeah, I think the event that we did this summer through the Men's Health Initiative and White Rock Baptist Church and the Durham Public Health Department was really great. I think those are outstanding programs. That's how you and I connected, and then you followed up with this invitation to be on your podcast, and I really appreciate that. Just to let the audience know just a little bit about me. I am a native North Carolinian, originally from the Charlotte area, but I've lived in the Triangle now for almost 30 years, and call Durham home. So really love the area. What I specialize in is really what's known as reconstructive urology, but within that is a really big component of men's health. A lot of men who are cancer survivors, maybe they have some deficits after being treated for prostate cancer or bladder cancer. Also treat a lot of men who are trying to recover their urinary function or their sexual function. And as part of all of that, we really try and emphasize male wellness and taking good care of yourself. And part of that is what we're going to talk about tonight, and that's sort of the prevention and management of diabetes and how it can impact the urinary system, as you were alluding to earlier.
Yeah, it's what that thank you, like I said, thank you so much for just, just all the work that you do. And like I said, if you want to know anything about men's health and urology, this is the guy to talk to. This is the person that talk to. What would you say, like, the first thing that people say, that a lot of people say, like, so what does that got to do, the stuff going on down there, what did that have anything to do with diabetes? I don't know how that's related. How's
Yeah.
that related?
That's a really great question, and you're exactly right. You're exactly right. A lot of men, maybe if their sugar gets a little too high, maybe they feel a little bit different, or they're told that their A1C is a little bit high over these last 3 months, but that doesn't always connect to something that's going wrong. And you earlier you mentioned to some of the eye problems that can come from diabetes, and some of the extremity problems like your feet and your toes and things like that. So diabetes has two really major impacts in the urology world, and I'll put them into two broad categories. One category would be sexual function, and the other category would be urinary function. Now, I think a lot of the audience probably understands that diabetes is just really, it's a hard time managing the sugar or the glucose that's in your body. And sometimes that can be because your body just doesn't metabolize it, or maybe the insulin doesn't work as well, or the pancreas doesn't work as well. But the end result of that is the elevated or increased sugar levels in the blood can do damage to the nerves and to the small blood vessels. In particular, some of the audience may know that diabetes increases the risk of heart attack. It increases the risk of stroke. It increases the risk of diabetic retinopathy, which is an eye problem. And all of those are a result of what we call small vessel or small vessel occlusion or blockage, or just simply small vessel disease. And those same types of small blood vessels that are in your toes and your fingers and the ends of the blood supply to the eye, those are the same types of small blood vessels that help to produce and maintain the erections that are so important for sexual function. The other part of the equation is that it can damage the nerves. So if you've heard the term diabetic neuropathy, where sensation may be decreased, that can also happen in the male sexual organs. Now, the other big thing that I mentioned is urinary dysfunction. And so oftentimes men with uncontrolled diabetes will have more bothersome urinary symptoms. And those could be things like more frequency and urgency, having to go to the bathroom more often, nocturia, which is getting up at night to go a lot. They can even have accidents because the bladder spasms or contracts when it's not supposed to. And in fact, if patients go years and years and years with poorly controlled diabetes, ultimately the bladder can stop working, and that's called diabetic cystopathy. Unfortunately, we don't see that too often, but that is a risk of long-term poorly controlled diabetes.
Yes, yes, and that is so interesting. So that's a thing that a lot of people don't make the connection to, is that one of the biggest signs of uncontrolled diabetes, especially in top two, is the increase in urination. You just more frequency, and that a lot of men tend to miss over. Sometimes people believe that that's something of a thing of getting older. That yeah, I just go more because I'm getting older, and not necessarily correlate that to like uncontrolled diabetes. A lot of times that's one of the main symptoms that people experience before they even diagnosed with type 2 diabetes, that maybe people overlook and kind of ignore, that kind of brush it off as especially if they're getting, in their 50s and 60s, and they just really, that's just a thing of getting older, not that it's a symptom of uncontrolled type 2 diabetes. And then also just the thing of even having problems with erections, then people still, well, that's just thing of getting older, not that it's related to like not having the diabetes under control and how that affects that. What would you say to someone that's being diagnosed with type 2 diabetes, and they're concerned about, they don't know what's going to happen with that? What would you, or what do you tell like patients that you run across that you may be working with, and then they're diagnosed with type 2 diabetes?
Yeah, absolutely. It's a very common scenario, and actually, you brought up a really good point. You kind of set this up perfectly for me. A lot of times, several times a year, I'll see patients in the office who have never been diagnosed with diabetes, but they come to see me because they have really bad urinary frequency and urgency. And we check a test, a very simple test called a urinalysis, where we check their urine. And then we see lots and lots of glucose or sugar in their urine. And then these are patients who oftentimes they don't have a primary care physician. They don't get any regular health care. They may be 40 or 50 years old and haven't seen a doctor since their high school physical. And we're making this diagnosis. So I would say for the patient who's newly diagnosed, Um, Number one is that doesn't mean it's the end of the world because you were diagnosed with diabetes. There's never been a better time in the history of the world to have the diagnosis because of all the resources we have these days to help take care of men and women with diabetes. I would say that first and foremost, trying to educate yourself as much as possible. And if you're not sure where to get good information, because I know as well as anyone that the internet can be really good and it can be really bad for information. You have to be very careful. And if you're not sure, then reach out to people that you trust, like your physicians. I would say educate yourself as much as possible. I would say that make sure if you're not sure why the doctor is recommending a certain medication or a diet change, ask them. Make sure you understand why they're recommending what they're recommending, because I think it helps patients be more compliant with their treatment when they're on board and they understand why we're doing what we're doing. I would say the other thing is it's super important to try and take good care of yourself. And I realize that's very difficult these days. Everyone's pulled in a lot of different directions, but try and keep it simple. Don't overwhelm yourself with major, major changes. Look for little wins, little quick wins that you can get here and there, and keep it simple. At the end of the day, what you really need to do is try and get a little bit of regular exercise. Try and if you can, eat a diet that's more fruits and vegetables and lean protein than processed foods. If it's something that can sit on the shelf for 6 to 12 months, probably not the best for you. And I'm guilty of eating that stuff sometimes. I mean, it's the way of life. But just try and moderate that. Sodas are a big one for a lot of patients. Trying to just if you drink 3 a day, maybe cut back to 2 or cut back to 1. Be very reasonable about that. So again, number one, a little bit of exercise. Number two, watch your diet, but you don't have to be a fanatic about it. And then, some things that we don't think about, like trying to get a good night's rest. Try and get adequate sleep. We're just learning so much more about how sleep is so important to your overall health. And then I would say last but not least, maybe this is easier said than done, but find ways to reduce stress in your life. And that might be through friendships. It might be through hobbies. It might be through sports. It might be through your church. I mean, there's a lot of different ways that you can do it, but try and find ways to reduce your stress a little bit. And all of those things together can make a big difference in your long-term outcome.
Yeah, yeah, that's exactly right. And that's the thing that when I go out in the community and give talks and things like that, it's a lot of little changes can go a long way. You don't have to uh you don't have to conquer the mountain in a day. You just chip away at it a little bit over time, and just over time, you'll find that you will have conquered the mountain just by focusing on doing a little bit of things every day. Um, uh, and that is so just such a key to being able to do that. And I guess like another one of the things and a question I'm sure that comes up, especially when you go out and do programs, unfortunately, we see stuff, especially like you said with the internet now, we see so many products for men, health, men's sexual health online. You have some of the people, they have commercials about this product or that product is going to increase your endurance or just extend your sexual health. What do you say about products like that or people that run across? We all run across that.
Yeah. Yeah, I think first of all, we just have to acknowledge that as men, most men or a lot of men, sexual function, sexual performance, interest in that is pretty high. For a lot of guys, it's something that even if maybe their drive or their libido is not what it used to be, it's still a place where they want to be successful. And so what does that mean? It means that some of these products that you're describing, they are preying on a very vulnerable population. men who maybe have some sexual dysfunction or some urinary dysfunction, a lot of them are reluctant to seek help through a physician or through the regular healthcare channels because they're embarrassed by the diagnosis. They're embarrassed by the problem. And I get it. I totally understand. It's a difficult thing to talk about. But so instead of going to a physician, they turn to these, commercialized products, these over the counter products. And a lot of them make really big claims that just can't be substantiated. And I mean, it goes back to the old adage, if it sounds too good to be true, it probably is. Now, the reality is that most of these products probably, you know, worst case scenario, probably aren't going to do anything that's too harmful for you. They may not help that much, but they might lighten your wallet a little bit depending on how expensive they are. But they're probably not going to hurt you. Most of these over the counter products are sort of what we call, nutraceuticals or phytotherapeutics, things that aren't really regulated by the FDA. Now, on the other hand, there are some products that you may find online that have real controlled or FDA regulated medications in them. And you do have to be careful with that because you're not really sure what you're getting. If you're not getting it through a regulated pharmacy, you don't really know what's in there. You don't know who the supplier is. You don't know where it was manufactured. And you just have to be really careful. Patients will, I would encourage you, if you ever think about using something like that or buying something like that, ask your physician what they think. And I'm open to some of this stuff. I fully understand that patients are going to use these. And sometimes, the placebo effect is a real thing. The idea that, well, if I think it's going to help me, it will help me. And sometimes that's the case. Now there are things out there. You may see commercials for online sites like hims.com or roman.com. I think those are a little bit more reputable. I still think that if you just go to those places and they prescribe you, like a Viagra or Cialis or a medication like that, that's fine. However, they're not going to be digging into the weeds and looking for underlying problems. Why does Mr. Smith have this? They can't check your urinalysis. They can't check your blood pressure. They can't talk to you as much about your other medical conditions. They're really going to be very hyper focused on one thing, which is why, again, I would encourage everyone that listens to this podcast, if this is a problem, find a physician that you feel comfortable talking to, and let them work with them as a partnership on how you can reach the goals that you're looking for.
Yeah, exactly. The main thing is to get and seek help. There's no shame in getting help. We have to do more to release the stigma of men going to the doctor, and that there's nothing wrong with that. There's no shame in that. If you have issues like that with sexual health issues, there's no shame in that. That's happens to more men than you can imagine. It's kind of a
That's right.
hidden, secret that's out there, that everybody is as virile and as strong as they were when they were in their 20s and stuff, and then that's not the case
That's
a lot of
exactly
times.
right. That's
And
exactly right.
so,
And one of the first things that I tell men when they come in and we're having this conversation, I try and reassure them. And the statistics show that about 50% of men over the age of 40 have some type of sexual dysfunction. And as you get older in age, that's about 50% of guys in their 50s, 60% of guys in their 60s, 70% of guys in their 70s. So it is extremely common, and you absolutely should not be ashamed about it, because and oftentimes it's a fixable problem. It's not something you have to live the rest of your life with.
yeah, 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 and exactly, and just the correlation with type 2 diabetes, having good control of your type 2 diabetes goes a long way in helping maintaining a good sexual health as well. And I'm glad that you pointed out about sleep, and we've done podcasts before on sleep and the importance of sleep in health and the importance of sleep with type 2 diabetes. That lack of sleep, can cause your raise your blood sugar as well, or make it harder to control your blood sugar. That's one thing that you can do without medication that can go a long way to help like your health, your physical health and your mental health. All right. All right. Well, I really appreciate. I think that we hopefully that people gain some great information from you. And I hope that people can take away something from this podcast and use that for their benefit. And then if someone, even if you have a loved one, if you have uh, a father, a husband, a brother, a child, that has issues with that, they may have like type 2 diabetes, or you may suspect that they have a lot of the symptoms and they may not get it checked, and they're also having sexual health problems. Really encourage them to see, like say, like find a provider that you can, that you feel comfortable with, and that you feel that you can talk to, and you really need to get the type 2 diabetes under control, because like I said, that's the pathway to so many other problems. And to kind of head off those problems, having control of type 2 diabetes is crucial. And so I would just like you to give us like a last statement, what you would say to the type 2 diabetic listeners that we have, and people that watch the podcast out there, what you would say, what's important with that and their sexual health and urological health.
Yeah, I think just a closing statement. Number one, I would say you're not by yourself. We're in this together with you, and there are lots of physicians that'll take care of you. I would also say that, we have a lot of great treatments out there, not only to prevent some of the long-term complications of diabetes, but to manage them. And the first thing is just finding someone that you feel confident with, someone that you can trust, and someone that you can share this, because when we talk about sexual function and urinary function, those are very intimate parts of our human anatomy and our psychology and our emotions. And so again, you have to understand that we know this is hard, this is hard, but we're here if there's something that we can do to help.
Yes, yes, exactly. We know that. That's why I wanted to have you on there and on here today. And it is we know that it's a very, sensitive issue with a lot of men, but we want to give people the education to all right. Well, we really want to be able to get this issue out in the forefront and have people be comfortable talking about it, because it is such a crucial issue. It is something so related to their lives. So again, I thank you for coming on to the podcast today. And I know that it's extremely busy, and I'm just glad to get a few minutes of your time. And I hope that this podcast goes a long way to helping men feel comfortable about this issue, comfortable in seeking help if they have any kind of issues, to talk to it with their providers, or seek out a provider and be able to talk with their loved ones and significant others as well. And just like you said earlier, it's not the end of the world of type 2 diabetes. It's not the end of the world to have sexual health issues. These issues can be resolved working together with your primary care provider and other. Like I said, there's so many programs, so many things out there now that's available And then there's also even groups, a lot of organizations that you can talk if you feel like it with other men. And if you want to be in that kind of setting and feel comfortable talking about that, that's available now. So thank you again, Dr. Lentz, for taking a few minutes of your time to be on this podcast. And I just wish you like continued success. I know that he's over at Duke University, so if you know anything about Duke Health, you know that they have great people there, and he's one of them. He's one of them. This is guy that knows his stuff, and I'm just glad that have met him and been able to work with him. And I look forward to working with you again. If you ever need any help with anything, just let me know. And I definitely will reach out to you if I need any help with anything with men's health.
Well, thank you again for inviting me. It was definitely an honor to be on, and thanks for all you're doing to spread the word and to get these messages out there.
All right. Hey, well, thank you so much. And again, thank you everyone for listening to this podcast. Like I said, please like, share this podcast. This is, like I said, I think this is a very important podcast. Pass it along to a loved one that may not be someone that necessarily listens to podcasts, or they may not necessarily pay much attention to what goes on in social media and stuff like that. You could do a lot by just passing on this podcast. They can get like information. They could feel like this is something that they can get help with. There's people out there, there's resources out there. There's no need to be ashamed. So if we can do that with this podcast, then it's worth it. And like again, I thank everyone for listening. Just continue to like say, like, subscribe, follow. Shout us out on your social media. I know that a lot of my listeners, they got way more reach than I do. So I'll be glad to just promote this podcast, and just thank you again. And again, for us with Destroying Diabetes, we just want you to continue to be well. Thank you.